So we've had a lot of insightful sessions since morning. We've heard different definitions of smart cities. We've had insightful discussions about the different aspects of smart city. We've spoken about sanitation. We've spoken about integrated waste management. We've spoken about physical security. So now is the time to think that as we talk about physical security, should we talk about security from diseases? Should we look at healthcare, which is a basic service that each of the smart cities have committed to provide to all their citizens? We heard different definitions of smart cities. We heard how the honorable speakers were talking about their smart city being a healthy and happy city. Some speakers were talking about their smart city as a city that is free from social evils. Some were talking about their city as a city that provides comfort to its citizens. So in the light of all these discussions, and as we move from conceptualization to implementation, I encourage all of you to think about how we can make smart cities into smart, healthy cities. So during the next 15 minutes or so, we'll be showing you Optum solutions that can create smart, healthy cities. Now, Optum, as a part of United Health Group, which is a Fortune 5, $200 billion organization, is amongst the largest healthcare organizations in the world. We have been in India for 15 years, and we now bring that global public health systems knowledge to offer integrated health management solutions for India and its smart cities. So with that context, let's take a look at what are the components of a smart, healthy city. A smart, healthy city has to have a unique health record for each of the citizens. Now, the unique health record captures the longitudinal medical history of the patient, and this data should be able to be integrated and exchanged with all the stakeholders that are involved in the continuum of care. So if we see, the health record is actually the entry point of the patient in the system. So as part of Optum Integrated Health Management Solution, we have developed different form factors like the Health ATM, which you see at our booth, like a primary healthcare center that can be converted into a health and wellness center. These kiosks can be used to capture the patient demographics, conduct the basic vitals, and provide the primary healthcare services that are needed by the citizens at the time of need. So this actually increases the efficiency of the primary healthcare solution, and it reduces the burden on the secondary healthcare systems and services, because all the patients do not directly go to the district hospital. Only patients who have a need to go and meet with a specialist or a provider based at the district hospital do visit the district hospitals, because their primary needs have already been addressed. So unique patient records is a very important element of the smart city solution. The second key element of a smart, healthy city is an integrated network of intelligent and connected medical devices and solutions like HMIS, Health Management Information System, electronic health records, telemedicine solutions, care-based artificial intelligence, and population health analytics. So that's the second most critical element of a smart, healthy city. Now, once you have a record, which is the data, and you have the system, which is the network of devices that we just spoke about, we need to have standards in place. Healthcare, as we know, is a very sensitive subject, and it is one of the most highly regulated industries. So now that we've seen the solution, the question comes as to what is the schedule for implementing such a solution? What is the typical roadmap for implementing a program like this? Like any other projects, a logical, phase-wise approach with defined milestones is the need of the hour. So based on experience, this is the typical roadmap for implementation of a smart, healthy city. In the initial 3 to 6 months, EHR which is the backbone of the whole system, along with mHealth applications for the patients and the providers are implemented. On top of it, payment gateway integration, which is again a critical element because patients have to pay for the services that they're availing, or in case it is being funded by the government as part of the NHPS, then the payment and the product and the package details have to be accordingly entered and reimbursed in the system. After the initial 6 months, the whole concept of a My Health Center or a health and wellness center that serves to provide affordable, accessible, and efficient care to people in remote areas can be put up. As part of the My Health Center, the patients in remote areas are able to get their basic diagnostics done, get the basic consultation done through a nurse or a paramedic or an Ayush doctor who's present at the MHC. And in case of a specialist consultation needed, they are connected through telemedicine to the doctor who's sitting in the district hospital. So this increases the efficiency of primary care and reduces the burden on the district hospital. And of course, it provides citizens the care that they need immediately at that point. Once we have the basic system of telemedicine, My Health Center in place, we have the whole analysis that can be done on the data that is captured. The data can be used for disease surveillance by the authorities. The authorities can leverage this data, see their dashboards, and accordingly plan their healthcare programs and initiatives. So this is the typical roadmap for developing a smart, healthy city solution. As we saw in the use case, the typical benefits are availed by all the stakeholders that are involved in the continuum of care. So the patient primarily is able to get the right services at the right time. They are able to get their unique health record in place, and they do not have to carry their paper forms and their patient file from one provider to another. They are able to visit different levels of healthcare services and be ensured that their healthcare data is secure and safe in the HMIS system. The provider, the other key stakeholder in the smart health city, is able to improve the quality of care that they're providing because they're no longer seeing 100 patients a day. They are seeing patients with scheduled appointments. They are seeing patients whose data is already in the system. So they have access to patient data, accurate patient data at the right time. The municipal authorities and the commissioners have latest real-time data on the disease profile and healthcare burden of their area, and they are able to use that to accordingly design and implement healthcare programs and policies. In addition to that, we understand that community engagement and outreach is a critical element to the success of the whole program. So the IHMS system has inbuilt outreach and community engagement mechanisms so that we are able to get rid of the traditional biases or social taboos against some technology implementations, etc., and engage and encourage people to visit these centers, get their tests done, get the data registered, etc. So these are the typical benefits that all the stakeholders who are involved in the continuum of care would be able to avail. So with that, we come to the end of the presentation, and I'd just like to end by saying that Optum, as a part of United Health Group, which is the world's largest healthcare company, is committed to India. We have been in India for 15 years, and we now bring that global public health knowledge to help the citizens of India live healthier and happier lives. Thank you.